Is that a yes, Frank? Sorry.
Good to go.
Yeah, go ahead. We're good to go.
Oh, I got everybody frozen.
Christina's working on her connection. Just hold tight, everyone.
Yeah, like I might have to move. I'm not quite sure what's going on. Am I frozen or am I good?
You're good right now.
Welcome, everybody, Board of Health. If you lose me for a second, I'm going to move to a different area of my house to see if I can get better Wi-Fi. I think I may just be competing with the K-12 system for Wi-Fi in my house right now. So, so sorry about that. Okay, welcome, everybody. I don't think we have anybody for privilege of the floor today, Frank. Is that correct?
That's correct.
Okay, so let's move and go right into the approval of the September 22nd minutes. Karen, could I ask you a favor? Could you resend to Melissa Dundaly the Zoom link for right now, please? Thanks. For the approval of the September 22nd minutes, can I have a motion and a second on those? Okay, I have a first from Sue, second from Shauna. Any discussion? Okay, all in favor as written? Can we do hands up? Okay, anyone opposed? And then abstentions. Okay, I think we're all set on that. Brenda, we'll go ahead and move on to you for, is Brenda on here? Do I see her, or are you doing summary?
No, Brenda is not. She's actually out on a medical leave. She had a fall in front of our building and injured her shoulder and ankle. So she's going to be out for a while.
Okay.
She's doing well, in good spirits and in recovery, but it's going to be a few weeks before she's back.
Okay.
I don't have a financial report necessarily. I know Karen Johnson in our admin office is monitoring and handling all of the financial stuff. So we don't, I don't have a report, but we also don't have anything glaring that we needed to bring to your attention.
Okay. Any questions on the financial summary? There was a summary in the packet as well. So, okay. Will you extend our well wishes to her and let her know that we hope that she feels better?
Will do.
And a quick recovery. Frank, then can we move right into your administrative report then, please?
Sure. So just a couple of things to update. I think we have gotten a couple of, or at least one application for the Board of Health. So we'll be compiling those and reaching out to the nominating committee about getting them together for a review. So that process will continue. Most of my time is COVID right now. The last month has been a little hectic as COVID has expanded all around us, and we've started to see an uptick here locally. Thankfully, not nearly as significant as Broome, Chemung, Tioga, Cortland have seen, but definitely have seen an uptick. We have community spread. We have cases that we have not been able to identify the source from. So we've done a lot of work in the last week or so with community town halls and public information, trying to get the word out to folks about remaining vigilant, continuing to wear masks, social distance, density, hand washing, same messages we've been having, but understanding people are getting tired of hearing it and quite frankly tired of dealing with it, but we need to because it's still there and it's still a risk. Since the last time we met, we did have our first resident death in Tompkins County, which obviously is tragic. And our well wishes go out to the family, but it does shed a light that we still need to be, we need to take this seriously and continue our efforts. We're trying to provide some additional support for the nursing team. In the last week or so, we did have a moment or two where it was all hands on deck. So we enlisted some of Liz's EH folks to do contact tracing for a day or two because our numbers had gotten pretty high. Not case numbers never really got above, I think, 12 or 14. Maybe it was a little higher than that, but really the contacts there were a lot of contacts. And so that takes a lot of time and energy. So they came in, sorry, I gotta let folks in. They came in and helped. Debbie's team has been helping throughout. The last few weeks, they've been doing more COVID than EI. And so, we've got to manage that as well. A couple of things that we're doing just before this meeting, the nurse managers and I were meeting with the virtual contact tracers from the state. So we're going to begin to start using them to help us do our contact tracing. It'll start slow because they have to staff up. They've obviously been very busy with what's going on in the Southern Tier, but we wanted to at least get it operational. So that way, if we do get into a situation where we have a lot of contacts, we don't necessarily need to pull folks from other places that we can use the virtual contact tracers. So that was good to get that ready to go. The nurse side of things, we have signed a contract with a traveling nurse company. So we're hoping they will be able to identify for us 3 nurses to work Thursday to Monday shifts to join a contract nurse that we have through CMC that's already working Thursday through Monday. So we'd have a team of 4 nurses working at those weekend shifts to help provide a little bit of relief for our folks. Thanks to Shauna and the legislature, they also allowed us to use some of our rollover for 2021 for some contract nursing hours. So that will supplement what we received from the state to do that. So we're trying to build in some relief for the nurses, not only to get them some time off on the weekends, but also to allow us to get back to some of the other work that needs to get done as well that we've put aside for 9 months at this point now. We've also gotten a lot of help from other county departments. So we have a cadre of, I think, about 30 volunteers that cycles through every 2 weeks, and they're helping us make calls to cases. So folks that are in isolation, to check on them to see how they're doing. They've also taken on contact tracing, and I think even a couple of them on our busiest days who are really good did some case investigation work for us. So they've been a super addition to helping the team make all of the calls that need to get done. And then just this week, the Emergency Operations Center has begun to build in some redundancy. So in Brenda's absence, Karen Bullis, who's the deputy of the Office for Aging, has been reassigned to the health department. And so she's going to be providing some operational leadership and support for the Community Health Services Division for COVID, kind of filling in where Brenda was when Karen Bishop left. And then Bridget Nugent, who's actually in the room here with me, is our Deputy Director of Youth Services. And so Bridget is going to be shadowing me. We figured it was time somebody knew what I was doing every day and who I was talking to. So Bridget's going to be that person to kind of understand what I do and who I talk to each day. And then also she's going to be helping lead up the vaccination process. So as we start to meet with community partners about administering vaccine to the community, she's going to be kind of leading that project for us and supporting me in that. So excited to have her on board as well. So we are, again, now starting to build some redundancy and try to put more support around the process, because we have been doing this for quite some time and are likely going to be doing it for a bit longer as well. So I'll stop there and be happy to answer any questions.
Okay, questions for Frank, aside from complete shock that this isn't going to be over anytime soon. So I guess I would just comment, I would support. I think that the actions, it looks like you're taking to shore up and have some backup. I think that's going to be really important as we move forward, because this is going to be a long haul situation. So I'm glad to hear that there's additional people being brought in to kind of widen the circle of who is able to support the response here in the county. So welcome to everybody, Bridget and everybody else who's not on the phone. And thanks for stepping in and stepping up for sure. Okay.
Frank, I got a question about how much communication there is between you and the other counties. Obviously we're not shutting our county borders, but is there any way that Tompkins can provide support? Do the other counties need help to try to get control of what's going on?
They need help. We don't really have resources to spare with the level of work that we're doing. I think certainly Chemung and Broome are using the virtual contact tracers and have been for a while. So they have that resource. I don't know that there's really much to be done other than, people need to continue to follow the guidance, which I think was part of their problems to begin with. They're navigating through doing case investigations and contact tracing the best they can. I do talk to my colleagues on a fairly regular basis, mainly because we're finding out about cases that they own that we need to do work on and we haven't heard about yet. So I do reach out to them to try to facilitate getting information as quickly as we can. But they're swamped and it's all hands on deck. There's no doubt. But I don't know that there's much more that we can do from a county perspective to support them.
Great, thanks. Other questions for Frank? Okay, let's go ahead and move on to the health promotion program. And Sam is here, right? Yep. Okay, great.
Hi, everyone. I don't have much to add to my report, but all of you should be getting our press releases that go out. If you're not, please let me know. So you've seen our more recent ones, some public exposures this past week at Arby's and Staples. There was a TCAT bus rider. So hopefully you're seeing those and aware. That's it.
Okay, great. Any questions for Sam? Shauna?
Are we actually seeing any positives from people that are coming in after being exposed in some of these public locations?
Shauna, I don't think we have yet.
Okay. Thank you.
Great. Other questions? And Sam, I just had one quick question about the sampling site at the mall, because I know that they offered additional hours this weekend. Is that something they're going to do moving forward, or was that just because we've had some public exposures lately? Or is that now a new, that they'll be open every Sunday or Saturday or whatever it was?
No, I don't think it's permanent. Mondays tend to be a busy day for them because they aren't open on the weekend, and for folks that need testing for surgical procedures. Dr. Evelyn, you might know better than I do on what the plan is.
Sure.
Okay.
So no, the Sunday hours were in response to the postings about public exposures
Okay.
and some increased volume that we were seeing. So if we have high exposures, then we'll run Sunday hours. If not, then Sundays generally were a low volume day and it wasn't worth us keeping it open.
Got it. Okay, thank you.
Dave, have you seen an increase in volume though with the schools being open?
You know, surprisingly, not as much as we would have expected. We're getting a couple of kids, who are being sent home from school or have some symptoms, but we're not seeing like whole families come in with URI symptoms and those kinds of things. And most of the exposures, as Frank said, tend to be, I hate to say this, but people our age and older. who, well, your age and older. I don't want to put you in my classification, but you know, they tend to be adults. It's people who are having family gatherings, getting together and sharing food and being indoors and not having masks on. And next thing you know, you have 2 or 3 generations sick, and they tend not to be the little kids. It's like, you know, a 20-year-old, a 40-year-old, and a 60-year-old.
Thank you. Anything else, Melissa?
No.
Okay, anything else from other board members on this? All righty. Medical director time, Dr. Claypack.
Oh, and good afternoon. Good to see everybody. When we started this planning back in the late 1990s, and we brought together partners within the community to talk about pandemic, this kind of long time frame was key in the discussion, you know, talking about how long it would take. And we certainly are seeing it play out. And the other part of the discussion was the concern that the very people that we rely upon to keep us safe, to provide us with clean water, to take care of our roads, all the other essential services, they were at risk of their very numbers being affected by the pandemic. And with the rise and the more pervasiveness of community spread at this point, that issue is on our radar screen as a health department. We can't afford to have law enforcement with significant numbers of people out on isolation due to COVID or in quarantine. We can't afford that with the Department of Public Works. You know, you can just go right down the line. So reinforcing that message that everybody needs to be honest when they report their exposures on their daily check-ins with their employers, that they need to be honest when they talk to our nurses about what their contacts were and where they think they picked it up. All of that is going to add in the important factors in the equation of keeping our workforce going and keeping our community going. So this recent community uptick certainly does shift the paradigm for us to a large degree. I would add to what David just said about where people are getting these cases, that a fair number of them are travel related, going for baptisms or weddings or other functions. Some of them, we've had a couple that have been related to business. Somebody coming into our state from out of state to do a contract service, bringing COVID with them, people going out and coming back, et cetera. So travel is still a big factor that we have to continually talk about. And as you know, the governor's list, or the state's list, I should say, of states on the advisory list exceeds 40. And we would have Pennsylvania, Connecticut, and New Jersey on that list were it not that people travel across those state lines so much to live and work in New York State. So you can hardly go anywhere without really having to think about quarantining when you come back. And of course, that includes even within our own state. So we can now look at county by county what the case positivity rate is. And you can plan a trip based upon whether that county looks a very high risk or not. Of course, even if it's a low risk county, you still should take your precautions, but we can't sound those kinds of messages too infrequently. And I think I'm very impressed at how well we as a community, as a county, have focused our public health message and stuck to it. And that's due to the credit of Frank and Sam and Dominique, who's the PIO for the county. that they all have helped us all stay on track and not muddle the message. My concern at this point with the uptick in community spread is about offices. I'm concerned about the questions that offices are raising to me. And those questions generally focus around a couple of issues. Number one, how much should they shift their care of patients back to what they were doing in April with remote telemedicine? And while I haven't given them a cut and dried answer, I have said to them, you have to look at what the trend looks like. You have to consider what your population is. You have to consider what your practice is like, and you need to make appropriate changes to protect yourself and your staff. Because our headache is not only to see a breakdown in our county infrastructure, but a breakdown in our healthcare system. And practices are worried that they might have to shut down if they have a case of COVID in their staff. So I'm trying to clarify for them what the guidance is as to how they should handle a practitioner or a staffer who's got COVID, how important it is for them to continue to use PPE. But the other part of the equation is how quickly can they get a staffer cleared as being whether they're non-COVID or COVID. So their problem is my staffer answers yes to a question about whether they have a symptom that could be COVID. Technically, therefore, at that point, they should not work. They should not even have come to work. But to clarify whether, in fact, they have influenza or whether they have a common cold or whatever, requires us to have a reasonable turnaround time in testing. And so I'm working with David and with people at the medical center to try to clarify that for practices. Can they get a key person cleared in a reasonable length of time so that they know they can continue to work? One such example was in one of the practices, an LPN who delivers most all their vaccines to kids. And that person is key in keeping their immunization levels up to par. So if without that person, they would be crippled for whatever length of time in achieving a very important public health mission. So that's what this recent community spread uptick has raised foremost in my mind and the mind of practices around us. Particularly, we need to keep our primary care practices whole because there are one of our bulwarks to help contain the pandemic. Without primary care, we would be crippled in that mission. So it's important we keep them up and running and functional and as whole as possible. So those are the priorities. We have a marvelous team. I just want to give a note of appreciation. My day, ever since this started, is Monday through Friday morning briefing, 8:30 in the morning, led by Lori Sibley or Rachel Buckwalder, and sometimes by Debbie Thomas. We have between 25 and 40 people on that morning briefing. Our partners within the morning briefing cadre have expanded to now including, and I can't name them all, but Cornell Health, the New York State liaison for school contact tracing, the person from the medical center who heads up, who is a primary liaison with the testing and surveillance services of CMC. I can't emphasize enough, of course, other departments within our health department and also throughout the county. So I can't emphasize much how valuable this is to have this cross-fertilization and sharing of information so that if we have a case that involved a business, Liz Cameron is aware of it able to mobilize EH to take care of it. If it's an issue that the school contact tracers should help us with, she's there to help us and share information. So it's a very powerful synergism, free of turf battles. We don't see anything of that sort. So I think as a board, you can take comfort that there's a lot of people who are carrying the water. And I'm very appreciative of the dedication, the long hours that public health nurses are putting in to make this all happen. So thank you. If you have any questions, I'd be glad to entertain them.
Questions? Yeah, Jan.
Quick question for Frank, Bill, sorry. The morning briefings, is there someone or more than one someone there from mental health?
Well, I think Frank has been with us for the last month or more, ever since Brenda had to go out. And certainly Frank is in touch with mental health. In addition to the morning briefings, we have a weekly senior leadership meeting on Thursdays. That involves Frank, myself, Liz, Debbie Thomas, perhaps somebody else from community health nurses, especially as we get up and running again with Brenda's being out. And most notably with regard to mental health, the primary person heading up mental health, whose name I'm going to block on, Frank, help me out here.
Oh, Jeremy Porter.
Thank you. Yeah. And so, Jeremy, we often have a dialogue about mental health issues and how COVID is affecting it and what we should be doing.
Yeah, Jan, the morning briefing is very tactical related to the disease investigation side of things. So it is very focused on that. It's about a half an hour long, and it's really about the previous day's cases and the current day's cases. Yes, as Dr. K just alluded to, we do talk about it at the weekly senior leadership if there's issues, but I also meet every other week with all of the mental health and substance use providers in the community to talk about their needs, their organizations, as well as the needs we're seeing in the community and how we're able to meet those. So there are ongoing conversations about mental health and substance use needs in the community.
Sue.
Yeah, so I read that Governor Cuomo was thinking about either replacing quarantine or supplementing it with more testing if you're coming from out of state. And I just wondered what anybody thought of that idea and if that was going to impact the amount of testing the county's going to have to do if you should go in that direction.
I don't ever pretend to know what the governor is thinking or planning to do. We generally find out on his press conferences, just like the rest of the world does. It is challenging, right? As Dr. K alluded to, I think 43 of 50 states meet the criteria, including Pennsylvania, New Jersey, and Connecticut. There must be millions of people that commute from those 3 states into New York for work every day when you include New York City. So there's just no way to realistically do it. I think the travel quarantine was initiated at a time where the disease levels in the country were different, and it made more sense. I think now as we're progressing to a time where we're hitting record numbers of cases across the country, it becomes less and less practical. I do agree and support the governor's approach with the more very specific cluster initiative approach, where we're targeting those areas that have the highest cases to try to get that contained. I think it makes more sense at this point in the pandemic than doing things on a statewide basis or even on a regional basis. Let's target our resources where things are most are being transmitted most frequently. It's tough. I don't know. When you look around the country and you see what's happening, and there's still large swaths of the country that don't think the basic public health guidance is something that they need to do, that we're going to be in a position anytime soon where numbers aren't going up. So I don't know. I don't know how we're going to approach that. Obviously, it will be a state decision related to travel, but it has wide-ranging impacts. It drives the higher education process, right, for bringing folks back in the spring, right? We dealt with it with the fall, and we're going to be dealing with it again in the spring. So it's an important decision, but I don't know where it's ultimately going to end up.
And Frank, are you also able to comment on the change from the CDC and their definition of close contact?
Sure.
Okay, and whether that's going to necessitate changes in who you quarantine?
Sure. So in case folks hadn't seen, the CDC in the last, less than a week, I think, changed the definition of close contact to 6 feet for 15 minutes. But that includes cumulative time over a 24-hour period. It doesn't have to be 15 minutes straight. Just so you know, New York State's directive has been 6 feet for 10 minutes, which is what we follow and what we will continue to follow. But locally, we had already been implementing cumulative time. So practically, it's really not going to make a big change for us. The example that I use is, in an elementary classroom, a teacher needs to use the restroom and an aide goes in for 5 minutes 3 times throughout the day. We would consider that person a close contact because they had a total of more than 10 minutes of time. We were really looking at like finite periods, like a work shift or something like that. So it will change a little bit to include a 24-hour period, but I don't think it's going to substantially change who we were putting into quarantine.
Frank, can I ask another question to Frank?
Sure.
I know we texted a little bit about this, but with the community spread rates going up and people not knowing who their contacts are, I know we're not testing necessarily the household contacts on day one, which seems to me that we should probably start doing that. This way it'll make a difference in our contact tracing, right? So if we're waiting for them to test till day 5, then you're not going to trace back the people they were around before. Do you know what I mean? So I'm wondering why we're not doing that, and what's the rationale?
So technically there is no requirement to get tested when you're in quarantine. We do recommend to folks testing, as you said, at day 5 or 7. I think the challenge is we assume that the case that we first identify is the index case, and we would want the others to have time to incubate the disease before they went and got tested. There is a downside to people getting tested on day 1 and being negative, in that they might not be as likely to successfully quarantine. In that, so there is always that concern when we're dealing with quarantine. I think we're talking to people in these situations, and the nurses would evaluate that if someone in the family had symptoms earlier, that they would talk with them about getting tested. It is difficult because there is no requirement. And so we do try to look at case by case what seems appropriate for those situations.
Yeah, I mean, just in that one case, I had someone who tested positive on her surveillance test, so she was negative, and had no idea where she got it from, right? So it seemed like maybe the kids that were in the school should have been tested too, because she wasn't symptomatic and no one was symptomatic. So I guess maybe that's all. I get it if someone's symptomatic and gets tested, then to wait for it to be incubated. But if the person's asymptomatic and no one in the house is symptomatic and we don't know where it came from, maybe it would make sense to test everybody on the first day.
Yeah, and if there is concern, certainly we're working with folks about what appropriate testing would look like. But the reality is we can't force anyone to get tested, right? And so it's really about what are the standard recommendations. And if we start straying too far from those recommendations, then it's a slippery slope that we go down, because we could be talking about recommending or telling everyone that they need to get tested when the basic public health intervention is you look for the case, you look for the contacts, you quarantine, and then you go from there. Because particularly with a school setting, you could be talking about a lot of people that would need to get tested outside of the household as well.
Okay, thanks, Frank. Any other last questions or comments on this? All right. The Division for Community Health. Who is?
That's probably me too.
Okay. Is there anything in addition to what you've already said that needs to be covered from their
No, I think
perspective?
we've covered it, other than to say that Claire Espy, who is our next Director of Community Health, is scheduled to start with us on November 30th.
Okay.
Which I believe will be before our next Board of Health meeting. So hopefully you will get introduced to her at your next meeting.
Okay, great. So children with special health care needs, I think I saw Deb. Yes, Deb.
Hi, everyone. Really just a comment that yes, we continue support staff and nursing to do probably more COVID work in the last couple of weeks than we are doing our regular work, but we're hanging in there, and everything else is in my report.
Great, thanks very much. Jonathan, I'm sorry, any questions for Deb? Okay, Jonathan, County Attorney.
Yeah, I was going to let Frank do my report as well, because he's doing so well. No, I don't have any additional report.
Okay, great, thanks. Liz, Environmental Health.
Hi. So we had originally we were bringing TOSA apartments back to Board of Health today. We pulled that and we'll be bringing them back hopefully in December. They've made corrections to the system that seem to be effective. Their communication has once again dropped off to earlier levels. They've been pretty much unresponsive, so we haven't been able to get back in to take the surveillance sample to release the boil water order. So that part's been a little bit frustrating and is altering our proposed approach to the next steps for enforcement. We recently received a survey for the state septic system replacement program. That's the program where we can offer up to 50% funding to eligible properties generally along the lake to help them replace their sewage systems. The state is definitely seems to be tightening their requirements for that. And they may only be providing us funding for that in the southern end of the lake. I submitted some comments on that, and they actually responded, and we'll have a conversation. But so I'm not quite sure where that program is going. It was hard to get people to use it, but it was able to do some effective things in the county. That's where we've put in some enhanced treatment systems on in lots on very small, for properties on very small lots. We're not doing much EH work at all. And we're hoping we'll never be audited on this year from the state, which I think is a safe bet, or we won't be any worse than anybody else probably. We are also still behind on responding to COVID complaints. They're coming in, generally faster than we can get to all of them, but we're making progress with there. The lead program has been active. EH is doing field visits on those cases by ourselves. The drought is much better, so that's good news. The city of Ithaca and Cornell have both released their water conservation advisories. We are monitoring the groundwater situation a little bit longer before we're lifting it because we'd like to see those levels stabilize. They tend to lag, so we just kind of want to see what happens in the next week or so, and then we'll probably lift it too. Loved seeing the rain again yesterday, although it doesn't help the COVID attitude to have the dreary day, but think about the drought. We had our rabies clinic last weekend, and that generally went really well. Those continue to be well received by the public and well utilized. And we have a new public health sanitarian starting on Monday. So we're really looking forward to that. So that's it. The minutes need to be voted on. I just thought I'd vocalize it. There's been some chat, but just thought I'd mention that the minutes for Board of Health need to be voted on. So that's all I have. That was probably more than enough.
Any questions for Liz? And then, so we have no enforcement actions from you today, correct, Liz?
Right.
And then, do we have any other new business before I circle back to the minutes?
Nope.
Okay. And so, Frank, how do you want me to handle the minutes? Do I need to reintroduce the minutes for a vote and revote, or can we?
I think you had a motion in a second. You can just ask for the vote again and do a
Okay.
count.
Okay, so let's, just because we had a couple folks that were having problems with audio and connecting, so the second was already on the floor to approve as written. So we'll go ahead and vote again. All in favor of approving the minutes as written? Okay, anyone opposed? Anyone opposed? And anyone abstaining? Okay. And Sam also is reminding everybody it's Lead Poisoning Prevention Week. Okay.
Don't eat any paint.
Don't lick your walls or eat. Yes. Okay. Anything else for the good of the group while we're together? And then maybe just as a reminder, since we're heading into November and December, is our next board meeting a combined meeting at the beginning of December so that we have no meeting in November? Is that correct?
That is correct.
Okay. It's just so everyone has it on their schedule properly.
Karen, do you have that date in front of you?
I may have it on my calendar already. Someone else had it quicker than me.
I saw a thing,
December 8th.
December 8th.
Okay. Okay. All right. Anything else for Frank? Or Frank, do you need anything else from us while we're here?
Nope, I think we're good.
Okay, do we want to do a motion to adjourn? It's a little hard to do these sometimes. If someone want to make a motion to adjourn. Okay, and a second on that. Okay. Anyone want to talk about it or object? Okay, have a great October and November, and we'll see everybody in the beginning of December.
Happy Thanksgiving, everybody.
Happy Thanksgiving.
I'm gonna
Yes,
go
bye-bye,
vote.
everybody.